Hey community, we're back, and I'm Brandy B, the community MP.
And I'm Brandy G, the community MP.
And together we are
B&B, the community MPs.
So today, B, we're going to talk about prostate cancer.
Yes.
We did a video before about screening for prostate cancer. So that's basically, just getting tested at, every 1 to 2 years to make sure you don't have prostate cancer. But if you do, now we're going to talk about information
about prostate cancer.
Yeah.
As promised.
As promised.
All right, so tell us the definition of prostate cancer. Of prostate cancer.
So basically, it's when the cells around the prostate, when the normal cells start to change into abnormal cells and grow out of control. And basically, what the prostate gland is, it makes part of the fluid that goes with the semen.
Okay.
And then where it sits is like below the bladder at the base of the penis. What are you doing there?
Because that's how we learned how to do the exam.
Oh, yeah.
The 2 fingers.
Yeah. Why people don't want to come see you for a prostate exam.
Okay.
But anyways, it surrounds the urethra, which is the urethra is the tube that carries the urine out. So
Okay.
that's why you typically see urinary symptoms with prostate problems.
Okay, so some of the facts. So prostate cancer usually occurs in men age 50 and older. Mm-hmm. It's very common. It's a common cancer, but people usually don't die from it.
Correct.
Usually die from something else because it grows really slow. So that's why.
Yeah.
That's why. Okay.
So you were telling me about a study you had.
Girl, years ago, I remember in nursing school, there was a study about prostate cancer, and they were saying that they did autopsies on these several male patients, and it was random autopsies, and a lot of the people had prostate cancer, but that wasn't their cause of death. So that makes sense that it's a slow-growing cancer, but people used to die from something else besides the prostate cancer.
I wonder why.
I don't know.
I wonder why prostate cancer affects so many people.
I know, because I don't have like 2 relatives who've had prostate cancer. And my great-grandfather, he passed away from prostate cancer.
Really?
He was in his 90s.
Oh.
Yeah. All right, so some of the risk factors.
Being a man, of course.
Of course, you have to be a man. If you don't have a prostate, you can't get prostate cancer.
That's right.
Okay.
So, and then being an African-American man, and also African-American men are more likely to die from prostate cancer.
And when I was just wondering why, when I read this, I was wondering why. And all I could think of, and this is me, my thoughts, is that not getting screened.
Right.
They're scared of the digital rectal exam because it's the first thing my patients ask me. You gotta stick your finger up my butt? No, really, but they don't want it done.
Yeah, because that was the way to do it for a long time.
So they don't, and I tell them, go draw some blood work and we can get it done. But yeah, I think that may be one of the reasons why, because I know trying to get my family members, my dad, my husband to go to the doctor, it's like pulling teeth. So it's kind of, that may be a reason why.
Yeah.
Okay.
I think me and Tony were talking about this the other day, and I was like, I could just do your exam for you. And he was like, I'd never be able to look at you again. I said, well, what about Brandy?
No.
He said, no. He said, absolutely not.
No. Okay.
But so
some of the other risk factors, family history. If you have a brother or a dad who had prostate cancer, you may be at risk for developing prostate cancer. Even if you had a family member who had breast cancer, you may be at risk because of the BRCA gene. You may be at risk for developing
I thought that was
cancer.
interesting.
That is interesting. Yeah. Okay.
And then, of course, having a diet high in animal fat or low in vegetables.
We know who don't eat animal fat.
That's true. That's me.
Okay.
Or animals. Or anything that has a heart. So signs and symptoms.
All right. So some of the signs and symptoms. Changing your urine flow. Some people may go frequently. They keep going. Some people may dribble.
Yeah.
So they may just pee a little and drip and drip, drip, drip. Or some people have to force. They have to force themselves to go to the bathroom. So that's some of the symptoms. And sometimes you don't have no symptoms.
At all.
But yeah, a lot of my patients that I've diagnosed with prostate cancer didn't have any symptoms at all. It was because I got the PSA for screening that we realized they had prostate cancer.
Yeah, same.
Okay. So just because you have those symptoms
does not mean you have prostate cancer.
Okay. Because it can be what?
Benign prostate hyperplasia or an infection. So it may just be BPH or some type of infection. So, but if you have the symptoms, go get checked so that we can make sure that it's not prostate cancer and it's something that it can just be treated.
Yeah, because when I see those symptoms, I check for infection, urinary tract infection, a prostate infection, even STIs.
Yep.
I'll check for that also.
Yes.
Okay. So screening. So some of the tests that you want to do for screening.
The PSA, which is blood work.
Okay, that's what. So guys, you don't have to get the rectal exam.
Right.
You can get the PSA.
Yeah, but when I was doing clinicals, people were still doing the rectal exams. I personally don't do them because
My patients don't let me, so
we can get what we need to know in the blood work, and then if there's some concern, then we send you to see a specialist, and they may have to do a biopsy.
Yep.
So.
Okay. So screening usually starts at age 50. And if you're African American, you may want to we recommend that you get screened early at age 45. And usually every 1 or 2 years, but I do every 1 year.
Yes.
Every year. What about you?
Every year.
Okay. So let's see some treatments. So how do we treat prostate cancer?
Well, acute surveillance, like where you're just watching and seeing what happens. So that's sometimes an option if the urologist or whoever thinks that it's there, very slow. Let's just watch it. Okay. And then there's surgery, radiation, hormone therapy, and chemotherapy.
And so I'm glad we're talking about the treatment, because what I've noticed is I have patients tell me they don't want to know. If I have, I don't want to know. But I try to tell them, if you have, there's treatment. People live with this. People live with prostate cancer. People get over prostate cancer. So if you have it, you want to know, because it's treatable.
Yeah.
And I done seen the way it metastasized when it wasn't treated to the bones.
Yeah, and that's painful.
Yeah, I had a patient who had back pain, and the back pain was metastasis from the prostate cancer.
Ooh.
Yeah, so it is treatable.
Yes.
So that's why
get treated.
That's why we're giving you this information, so we want y'all to know.
Yeah.
That. Yep. All right.
Take care of yourself.
That was a short, sweet video.
Yes, it was.
Prostate cancer, but I think it's a very important video.
For sure. Yes.
Especially for African American men. It's a very important video. So just remember, this stuff is just not for women; it's for men too.
Yes.
Yes.
All of our videos, unless because I was gonna say unless we're talking about breast cancer, but men can get breast cancer too. So every video.
And if they got a woman,
Just stay in the know, okay? We giving you free information for you to stay in the know.
Yes. Okay, so let's tell them. Well, you want me to tell them, or you gonna tell them?
The disclosure?
All right.
You know that's you. That's all you.
All right. So as we said, this information is just for educational purposes, for you to share with family and friends. It's a spark of conversation.
Yes.
It does not take the place of you going to your primary care provider. It does not. Period. Okay? So we want you to go see your primary care doctor at least once a year, so you get this screening. You can get so when you go back, you can ask, did you screen me for prostate cancer? Yeah. So if you're 50 years and older, if you're African American male, 45 years and older, did you screen me for prostate cancer?
Yes.
So, okay. So where can they find us, B?
Facebook, Instagram, YouTube. We are B&B, the Community MPs. We would love your feedback, ask us questions, interact with us. We want to answer your questions.
Yes.
Okay? So, yeah.
So what you want to do? Subscribe, like, share.
Subscribe, like, share.
And follow.
Yes.
Okay.
And why do we do this?
Because community is our beauty.
Bye.